The crown area is actually an area which is very demanding in matter of number of grafts and also challenging on how to make it look dense. The problem with the crown is that unlike the frontal area and the mid-scalp, that when you comb your hair backwards, or as most people do, there is a layering effect of hairs one behind the other that altogether will give a thicker result due to layering. On the crown, since the normal growth is a spiral growth, we can only transplant one single layer of hair follicles and there is no layering effect. That means that on the crown, even though you might go for a dense hair transplant exceeding 30 or 35 grafts per square centimeter, sometimes you can still see the skin in between the hairs and give the illusion that it's not so thick. Actually, it is thick, but since it is a single layer of hair which is whirling in this area, it is extremely hard. Only on very specific cases that a patient has thick hair, the crown will look fully packed and fully dense. For those patients who are not satisfied, even though their growth is 100% and the area is dense packed, that means that actually 30 to 35 grafts per square centimeter on the crown, some will opt in for a second session. The reason why we cannot give the same also density that we can give on the frontal areas, which is 40 up to 50 grafts per square centimeter, is that the angle, both the angle and the direction of the transplanted hair follicles does not allow for a very high density which can reach up to 50. Well, actually you can do it, but you cannot be at all sure that all 50 will grow. So it is much safer to go for a little bit lower density on the crown, which is up to 30 or even 35 grafts, follicular units per square centimeter, in order to be safe that this will grow. And maybe if extra density is required by the patient, you can go on a second session and add cherry picking grafts, add in between the previous grafts.